Genitalia will focus only in pelvis. First, you should recall the peritoneal pouches. Especially, this is the site of... Can you tell me the name of this pouch? Recto-vesical pouch.
Recto-vesical pouch.
The single pouch in male. So, this is the site of rectum. The inferior most part, this is the anal canal. And we have a space behind rectum. Maybe you know the name of this space. Rectal space. Rectal space between the sacrum and the rectum. Or you can call it pre-sacral space. Pre-sacral or rectal space. Next, anterior. This is blue urinary bladder. You can compare with our models to find out the structures. And inferior to the urinary bladder, this is prostate gland.
Prostate gland, yellow.
Yes, and into the prostate, this is a prostatic part of urethra. It continues in the membranous part, exactly here, and spongy part in the spongy body of the penis. And the space between the urinary bladder and pubic bone, this is a pre-vesical space. Or the same name, this is the retropubic space.
Retropubic.
Yeah, they're synonyms. Okay, in female pelvis, but without rectum here, only the anal canal is part of rectum, and vagina, cervix, uteri, cervix of uterus, the body and fundus are cut. So, urinary bladder, the same, pre-vesical space, and here, this is female urethra. This part, different from the male, of course. Well, we have no peritoneum, so we have no pouches without peritoneal compartment. And we can discuss the peritoneum here in the total preparation with peritoneum and vessels, nerves from the retroperitoneum to the subperitoneum in pelvis. Well, the main vessels, maybe you know the names. If we start with this, it would be abdominal aorta and inferior vena cava. Yes. So aorta splits into the common, yes, iliac, left and right. You should be careful. Common iliac divides into the external iliac artery and internal iliac artery. You can follow the subdivisions of internal iliac on the anterior trunk and posterior, and you can also follow the veins, accompanying veins. So, the common iliac left and right vein, they form the inferior vena cava. We have one unpaired artery here. Yes, which? Median sacral artery.
Median sacral artery reverse.
It is subdivision of the bifurcation and goes behind the left common iliac vein. So it's easy to recognize here. Well, the next of the nerve elements to the lateral wall, this is obturator nerve. And this is artery, but artery has cut.
It is retroperitoneal.
They are subperitoneal. Retro is approximately at boundary between the sigmoid column and rectum. This is the level of S2, S3. So these structures continue into the subperitoneum, and they are in lateral position according to the pelvic organs. So this is a peritoneum. We can restore the position of peritoneum structures. The rectum is cut here, but you can see this organ. Uterus. Fundus of the uterus and lateral. You can follow here the tubes, salpinx, yes, uterine tubes, right and left here. And they finish with ampulla here, not well defined, close to the ovary. This is the right ovary. Maybe you remember the ovarian ligament here, ovarian ligament, and maybe you remember the broad ligament of uterus.
Broad ligament?
Broad ligament, ligamentum latum uterus. So, between the uterus and urinary bladder, you can tell me the name of this. Anal is here. This is very, very far. This is one of the pouches. Vesico-uterine pouch.
Vesico-uterine
pouch, and remember that posterior one, this is the recto-uterine pouch. Here, between the rectum and uterus and posterior fornix of vagina. This is the deepest. Inferior-most extension of peritoneal cavity. What else? If you have any questions, we will discuss this. And finally, in the perineum, the subcutaneous compartment and fossa ischioanalis, as we made a picture, this is the anus and ischial tuberosity on both sides. So this is the entrance into the ischioanal fossa. The posterior border was, you can tell me the name of this muscle. Gluteus maximus, of course, yes. and inside this is the sacrotuberous ligament. But it's not clean. Only for theory I recall this. Sacrotuberal ligament to the ischial tuberosity. So the medial wall, this needle, this is the levator ani muscle. Levator ani muscle.
This is
On both sides. You remember the position? It's similar like a bowel. We said bowel or hammock shape. Into the midplane, this is anococcygeal ligament, ligamentum anococcygeal, to the coccyx. So this is external anal sphincter, sphincter ani externus, and position of vessels and nerves is lateral. You remember that they are in lateral position into the pudendal canal. So you can write here the internal pudendal artery, vein, and pudendal nerve, because we cannot distinguish very easy artery from vein, from nerve. They are together, all together. Well, this is it.